in the chat or raise your hand and we'll call on you. I'll unmute you and you'll be able to ask your question. Russell, you're good to go.
Thank you, Erin. Good morning. I'm Russell Myers, CEO of Midland Health, and this is Tuesday, April the 14th. Numbers in Texas today, just short of 14,000 confirmed cases. In Midland County, we have 32. There have been 287 deaths in Texas and 2 in Midland County. Our testing from the hospital's off-site testing location, now over 800 tests. 35 of those positive, that includes a few duplicates, 729 negatives. We're still waiting on test results from 50 patients, that's just the past couple of days. In our hospital census numbers, 120 overall in the hospital. Our emergency department saw 85 patients yesterday. We've been strangely consistent day after day in the mid-80s now. Still very low volume for the ED. Critical care at 14 this morning. Among our persons under investigation for COVID, we have 4 in critical care and 11 in med-surg environments for a total of 15. Only 2 of those positive confirmed so far. The last number to report ventilator use, 7 ventilators in use today of our 40 full-service ventilators, 44 capacity of full-service ventilators. A little financial update from the hospital. We have begun here lately to talk about the financial impact of this now extended pandemic experience. We will close the books on March here in the next day or so, and we're looking at about a $3 million bottom line net loss for just the 1 month, wiping out about 3/4 of the gain we've made so far this fiscal year. With a full month in April expected to see a downturn in activity and a minimization of elective procedures, losses in April could be double that. We could be looking at $5 or $6 million. So very significant financial impact. We believe at this point that we're able to ride it out through April. We've been fortunate in our early receipt of $3.7 million from the CARES Act distribution. About $100 billion was assigned to hospitals around the country. The first $30 billion has been distributed now, and of that we got $3.7 million. So that's about enough to overcome the losses we saw in March. We also are expecting within the next day or two an advance from the Medicare program to give us some cash flow. This represents essentially a short-term loan from Medicare that has to be paid back after 120 days. So we have some serious financial challenges ahead of us. We are staying the course currently. We've had good conversations twice now in the last few days with the finance committee of our board. We are very intentional about keeping things essentially as they are through the month of April. That means keeping our employees at work, keeping our benefits intact, continuing to do everything we can to serve our community as best we possibly can, and to keep our workforce preserved and healthy. If this extends well into May and beyond, I think we will have to look at some challenges, make some expense reductions, look for other sources of revenue. But as of now, we think we're in reasonably good shape, even though the financial hits have been significant. So there'll be more to come on that as we get through April and see how soon we're able to return to doing elective procedures and reactivating most of the work in the hospital that's been shut down through the pandemic. I'd like to commend our human resources staff this morning. We've had some real challenges. As you all probably know, healthcare turnover is pretty continuous. We're always sourcing and hiring new people, managing benefits concerns, during the course of this pandemic, dealing with a lot of policy change, interpreting new guidelines coming from the federal government and the impact they have on our employees. Our human resources team, for the most part, has been working from home, but they've been deeply engaged. They've come up with new methods for hiring people, for sourcing candidates, for orienting new employees right through this crisis. They've been real troopers and a real vital part of the team here. So today's shout out to our human resources team. Thank you all very much for the work you're doing. That is the end of my prepared remarks, and I'll take questions at this time.
Media, do you have any questions? Oh, Stuart with the MRT is wondering if the hospital district was approached with the chat initiative as well.
I'm not sure what we mean by approached. We're aware of it. I'm actually participating myself. Judge Johnson introduced it last week, I suppose, and I think my impression of the chat initiative is that it gives us a unique perspective on the broader community's health. It does so, of course, if people participate, and I think it could be a useful tool among the many tools we're using to try to understand the impact of this disease, not just on the people who are sick enough to come and get tested or be in the hospital, but on the broader community.
And then the next question is, how many total beds are available right now?
Total beds available in the hospital? Let's see, we've got 120 patients in the hospital, so that's about 120. I think our total capacity is 244, if I remember correctly, so 124 total beds available.
Russell, that's all we have for you.
Okay, I'll step aside. Thank you.
Is Dr. Wilson speaking today?
Yes, he's got a couple of
Okay,
questions.
perfect.
Thank you, Russell.
Good morning. I wanted to make a couple of comments about increasing news that I'm sure you're all hearing, that I'm hearing, about how well things seem to be going, particularly here in Midland. We've had what I would describe as a slow burn, not a significant gasoline fire of disease that we were worried we might experience. I believe that's largely because of everything that all of you have been doing, and we all appreciate that very much, the healthcare providers and everybody around us in the community, particularly those most vulnerable to this disease. As we look at that, there's a lot of activity and talk across the nation from the president, governors, our mayor, about when we can start our economic engines again, when we can get businesses moving again. And I want to be a little bit of a baffle to that, if I may, in the context that the reason that we're in a position to have these conversations is because of exactly what we've been doing. And the social distancing, the increased hygiene, et cetera, has made a difference in the way the disease spreads. I do believe also that here in West Texas, particularly in other places around the country, we're not in the same position that others are in urban centers where the population densities are much greater and the risk of transmission is much higher. But still remember, there's a lot of things that have not changed. This virus remains a very highly transmissible virus. It's got a very high likelihood of spreading from individual to individual when you're in close proximity to one another. It also has a higher lethality than many other viruses that we experience on a seasonal basis, such as the flu, etc. And because of that, we must maintain some level of vigilance and care no matter how we move forward with liberalization of policy, etc., to get back to moving forward. Clearly, we must do that sometime in the near future. But remember, the virus is still the virus. We still don't have a cure for it. We don't have a vaccine. We don't have wide availability of antibody testing to help find out who has immunity and who does not. It remains an infection that can be carried and spread in asymptomatic people. So as we begin to contemplate things becoming more new normal, I would say, let's remember that social distancing, wearing masks in public, hand hygiene particularly, and anything that we do that begins to liberalize will have to be different than we've done it in the past and thoughtfully implemented. Thank you. Any questions?
The MRT said there are some who believe the lack of testing is a reason for the low number of confirmed cases in Midland County. What is your response to those people?
I think that there's an element of truth to that. There's been a low amount of testing available and a slow return of test results as well, and that's been a frustration across the country as well as to us here in West Texas. However, the end result of the disease is a certain amount of patients end up hospitalized, a certain number of patients end up with severe illness, and our numbers have not skyrocketed. As I mentioned earlier, it seems to me that we remain in a slow burn. We haven't had a tremendous number of patients in our critical care unit, thank goodness, and we haven't had a tremendous number of people hospitalized. So despite the lack of widespread testing to recognize how much disease there may be in our community, we remain fairly optimistic that the numbers, 15% or so, as you've heard me say in the past, will end up hospitalized. Smaller percentage end up in critical care or with mortality from it. And those numbers, fortunately, remain pretty low. We have had 2 deaths, and any deaths is too many, but it still remains a pretty low number.
And then the next question is, what is the hospital's plan in case we do see a surge of patients?
Well, that's what I'm here to try to help prevent. And, we have all the same preparations in place that we've been working on over the last several weeks. Russell Myers has done a tremendous job, and if you want to give a shout out to anybody, I would give a shout out to our leadership within this hospital. Both he and Steve Bowerman, our CFO, have put the health of our community and the health of the healthcare providers in the forefront over the financials. I know he's got to be paying attention to the financials, and that's a really important piece of keeping our hospital alive. But in the face of that, we're taking care of our patients and our population first, making sure we have appropriate PPE for all our healthcare providers. We have the ventilators that he reports on every morning. We're prepared to manage anything moving forward that we must, but our goal is to not must, and to stay with the slow burn and keep things at a low level as we begin to do things to help keep the economy going well and keep the hospital and every other industry in our community viable.
And Tasa said she had a Facebook question to read, so Tasa, you can go ahead.
Yes, we have a Facebook question on our Midland Memorial Hospital page. It is, why are we still waiting so long for tests? Can you explain the time?
The whole nation is involved in doing testing right now. Every state has people with COVID, and there's a handful of outfits that are industries that are involved in doing the testing resulting for us. We are still waiting on a rapid test result here in Midland. I think we will have that very, very soon, if not today, but not a large number of them. And when we send out our tests to be processed, other places are sending them there as well, and it just backlog. It's a frustration across the country, and we're experiencing it as well.
We have another question from our Facebook page. Why are we not releasing location data of patients like some communities have, specifically where patients might have shed infection throughout the community?
You're talking about doing the contact tracing and identifying people downstream that might have been exposed to it.
Yes, sir.
That's the health department's role, and I'll let them answer that question. I don't mean to divert it, but it's really their role and their responsibility. And I think part of it is also that we all want to maintain everybody's privacy, and as long as we're protecting other citizens, there's no need to share information like that, I don't think.
Elsa, any others?
Yes, I have one more question. Have any blood types been shown to have resistance to the virus?
I've heard some anecdotal information about different blood types being less prone to the illness than others, but beyond anecdotal information, I don't think there's any hard science behind it, and I really wouldn't want to comment further than that.
We have one more question. When will antibody tests be available here?
That's an excellent question. I wish it were yesterday. It would make a huge difference for us. I'm hoping within the month, but any timetable that we've ever described about any of these things like this, it seems like they always get pushed back because there's so much demand, and the supplies are going to go to the places in the highest need. And fortunately, we remain at a slow burn, and we're not a high demand area. Okay.
Dr. Wilson, thank you.
Thank you.
Now we will turn over to the City of Midland Health Department with Whitney Craig. Whitney, you are good to go.
Good morning. This is Whitney with the Health Department. I want to start off by giving my condolences to the family that has lost our most recent case. I also want to give a huge thank you to the Health Department staff. They have been working tirelessly on doing our investigations and making those contacts that we so greatly need to make sure we can keep this under wraps in our community. I want to give a breakdown of the cases, and then Becky will speak on the investigation process, and then I will answer any questions. As of right now, we have 32 cases. The source of exposures, 13 travel-related, 14 contact to a known case, 5 community transmission, and 0 that are still under investigation. For gender, there are 15 male, 17 female. For age groups, we have 2 in the 0 to 19, 14 in the 20 to 29, 5 in the 30 to 39, 4 in the 40 to 49, 4 in the 50 to 59, 2 in the 60 to 69, and 1 in the 70 to 79. For patient status, we have 0 hospitalized, 8 that are in home isolation, 5 that have completed isolation, 17 recovered, and 2 deaths. For medical visit type, we have 16 that were tested at the drive-through, 7 at a clinic or provider, 6 in the emergency room, and 3 that were tested as inpatients. For investigation status, we have 29 that are still ongoing and 3 that are complete. Through our investigation process, we have discovered that there is no community exposure that would include the stores, restaurants, and the like. I'm going to turn it over to Becky now so that she can discuss the investigation process.
Good morning. This is Becky Smith, the nurse supervisor for the City of Midland Health Department. I'm going to go over the investigation process once we receive a positive case from the hospital or another private provider. Once we receive a positive lab form, I hand it over, I either keep it myself or hand it over to one of our nurses at the health department. We retrieve the patient demographic information, and then we contact the patient themselves or the immediate family member if the patient is in the hospital and unable to speak. We start off by symptom onset and the actual symptoms themselves, which are the main symptoms that we know of: fever, cough, sore throat, shortness of breath, as well as any additional signs and symptoms that we've since learned: the loss of taste and smell, abdominal symptoms, etc. We check on their the 14 days before symptom onset, travel, contacted cases, and so forth. If they did travel, where they traveled, the dates and times, if they were exposed to a known case. Our next information is if they're a healthcare worker, and if they've been in a healthcare facility as a patient, a visitor, and so forth. Now, as you know, more of that is starting to be no, because travel has been cut down, restaurants have been closed, visitors to healthcare facilities have not been allowed. Providing care for a COVID-19 patient has been cut down, because when we do have a patient that is at home, they're being asked to isolate even from family members. So more and more of that is, the answers are no. Our next set of questions are where the lab was done and results of other testing, for example, flu, RSV, pneumonia, x-ray results, and so forth. And then our next set are contacts since symptoms have begun. And each set of contact, each person, each contact to a case, there's 5 pages of questions we ask for that one contact. We contact each individual and find out where they work, what they do. Depending on the level of contact, we ask them to quarantine at home for 14 days or until the case themselves has no longer been, that no longer has symptoms, and 14 days from that point. If they're a household contact, they stay home 14 days after the patient is no longer symptomatic. If they're not a household contact, it is different. We ask each one to monitor their temperatures twice a day and their symptoms. Some report back to the health department, for example, the household contact, and some just keep a log for themselves. We follow these contacts and the patient until all of the contacts are completed. We contact them every 2 to 4 days, depending on if the patient is hospitalized, depending on the contacts and so forth. If any of the contacts develop symptoms, we help arrange an appointment to be tested either through the drive-through or their private provider if that provider is testing. And then we go with that case, we start with their contacts. And each case, each investigation can turn into a cluster if there's more than one case associated with it, or each case can be an individual case with itself, and there's no more contacts that become symptomatic. Each case can last a few days and be completed. Each case can last, it can be ongoing, and that's why we have so many ongoing and only 3 completed. And that's our process of investigations. Whitney? Any questions?
MRT. They said the number of people that went from home isolation to recovered or completed isolation rose dramatically, more than 50% over the weekend. How does that happen?
Can you please repeat the question?
The number of people that went from home isolation to recovered or completed isolation rose dramatically by more than 50% over the weekend. How does that happen?
It happens to, the completed isolation has to do with when the symptoms stop, and then you go out 3 days from there for an actual patient. And so that it all has to do with time and when symptoms end. So that is how it is figured when they complete isolation. Now the recovered status is, like I explained one day last week, it's a new category, and it has to do, it doesn't have to do with when isolation ends, it has to do with when a patient feels like they can return completely before COVID back to their normal daily activities, example, work, daycare, and so forth. So our patient, our first set of patients are starting to get better, going back to work. Isolation, of course, is over, and then, they're going back to work and are recovered, or they're back to their normal daily activities.
Next question.
Let me give them a second, see if there's any others. Okay. Becky and Whitney, thank you.
Thank you.
Katie, you are good to go. Wait. There you go.
All right, well, hi, I'm Katie Atkins, Chief of Staff, Midland ISD. A couple of updates from our district. Yesterday, we shared on our Facebook Live that we have now stood up a document on our website under midlandisd.net/COVID-19 under news and announcements. That document is in reference to our progress monitoring codes that we have now published for the community. That was shared out to our parents yesterday. So a couple of highlights to know from that is that as we are still continuing to not take grades, we are going to be progress monitoring our students. So we have determined some codes to indicate on track to mastery, which would be denoted as OTM, not on track as NOT, and I as incomplete. So what parents need to know from that is that on April 17th via Skyward, they're going to be able to access a progress report, and it will include these codes. And again, that information is available on our website for more robust information regards what those codes mean and what to do with those next steps. We mentioned also that at this time we determined that we would not go to the pass-fail system simply because that system was not going to be in the best interest of all of our students. For example, pass-fail would negatively impact students who had received an A or B in the course because it awards a 70 for the spring 2020 course average, and so that would not be in the best interest of our students. We've stood at that information also on our website underneath that document on midlandisd.net/COVID-19. A couple of other things to be aware of. We have our new school year enrollment. We've started that. That began yesterday. This also includes kindergarten. We're having to do some things differently than what we've traditionally had in place with kindergarten roundup. But we are going to start enrolling our kindergarten students. Again, we want to make sure that they're introduced to their new school environment. So once we have our restrictions are not as stringent and things of that nature, once we have a little bit more time to determine what that looks like, then we can talk a little bit more about what kindergarten can include. But at this point, kindergarten is included in our new school year enrollment. That is for information on that, www.midlandisd.net/enrollment. All enrollment questions can be found underneath that website. Pre-K registration is still on hold because through that process, we also do some assessments that are not necessarily done virtually, so we're still working through that process on what that would look like and the best way to enroll those students, but that registration is still on hold at this point in time. We do have some updates on our learning technology. Our Wi-Fi equipped buses rolled out yesterday to our sites. These are our sites out in the county where we have our meals locations. Those buses are on site from 8:30 a.m. till 12:30 p.m. Monday through Friday. We've also boosted our Wi-Fi to the parking lots of many of our buildings and several city parks. For further information on that, people can certainly visit midlandisd.net/COVID Wi-Fi for a complete list of what those are and where those are located. We have had also a number of questions about hotspots. Our campuses have been working to determine families that are in need of those hotspots. Hang tight because we're still in the process of making sure that those are delivered and those are passed out to those who are in need of those. So please be aware of that. And we also, last week, we started our soft rollout of moving to Google Classroom. As a part of support with that, we did stand up a technology helpline for parents and students in regards to technology support. That number is 432-240-1110. It's staffed from 8 a.m. to 5 p.m. Monday through Friday, and help is available in both English and Spanish. At this point, I'll take any questions we have for Midland ISD.
Right now we just have one, and they want to know, how does progress monitoring affect end of the year GPA?
So we have some further information that we will be sending out specifically to GPA at this point in time. But one thing to know is that we have both qualitative and quantitative measures. The quantitative measures were the grades that were in place prior to COVID. Following COVID closure, we moved to a qualitative approach. So we're going to be sharing more specifics about GPA and how that impacts GPA. And we'll stand up that document in the very, very near future. But that's still something that is being refined and worked on, so we'll have that. Also, another thing that I do want to share with people have been asking questions about seniors. We do have now on our webpage specific questions pertaining to seniors. If you go to midlandisd.net/seniors2020, there's some further information about seniors and on our various campuses, so that's something to also look into as well.
We'll give them a few seconds to see if the media has any other questions. Edie, thank you.
Okay, thank you.
Judge Johnson, the floor is yours.
Okay, thank you. I'd like to start out by saying thanks and a great big thanks to everybody that's on the front lines. This includes everybody in healthcare, providing service that are keeping us safe, all the public employees from the police, the sheriffs, fire, all the first responders included, grocery store personnel, restaurant workers, everybody who's helped keeping us together during this time. I'd also like to say thanks to the Midland County Commissioners Court for embracing chat yesterday. This is a tool that I think is going to help us. I really believe in it. Last Thursday, I said that I asked you to please chat with me. In less than 4 days, we've had almost 700 people text chat to 432-287-7337, and we've just begun. I want to say thanks to Russell Myers for being one of the participants. I want you to remember, chat's not simply a text message. It's information that we can use to help us get back to normal. And of those that have joined us, 9% have reported having symptoms. This information can and will help our hospital, our city, and our county manage our response to the virus here in Midland County. But we need you. Like wearing a mask and social distancing, more people who can chat, the better information we'll have to slow the spread and ultimately get back to normal. So I'm going to ask everyone right now, if you would, who's watching, please pull out your phone and start a new text message and text the word chat, C-H-A-T, to 432-287-7337. Once again, that's chat, C-H-A-T, to 432-287-7337. Thanks to everyone for everything you're doing to help in this and help slow the spread. Thank you.
All right, Judge, we'll just give them a few seconds to see if they have any questions. Judge Johnson, thank you.
Thanks.
Mayor Payton?
Thank you, Aaron, and thank you to everybody who's been on this call and everybody who's watching. I want to begin by echoing what Judge Johnson just said about all the thanks to everybody who's serving, whether it's at the front lines of the hospital or the front lines of a grocery store or the front lines of a safety worker. Thank you for everything that you're doing and through this whole process. Let me just go over a few items. First of all, just another thanks as well to the citizens of Midland, as well as Midland, Odessa, the job that you're doing. As I drive around town, watch what's happening in stores, watch what's happening in to-go lines in various places around the city, it seems like all of our citizens, for the most part, have settled in to somewhat of the discipline of a new norm. And so thank you so much for that. I know for everybody that I'm speaking to and everybody that's a part of this process, there are times of frustration. We wonder when this is going to slow down or when this is going to end. But thank you again for everything that you're doing, for how you're encouraging each other, you're taking care of each other. And again, as Dr. Wilson said, I think one of the reasons that we're seeing such, as to use his term, a slow burn as compared to other places is not only our geography, but also because we as Midlanders have decided to pick up this fight and take care of it ourselves. So great job. Here at the city, we're entering into a new phase of long-term planning. We were beginning a long-term planning process a little over a month and a half ago. That long-term planning process got changed because of what we're going through right now. But we'll begin to ramp up what we're planning for the future, knowing that the future is a little bit unknown right now as we take a look at where things are financially, where we're going to have to be financially, and what are going to be the priorities of the city as we move ahead, realizing that we're not just going to stop everything and everything's going to be back to normal in the next 2 weeks. It's going to be a different time for us, especially when you look at what's happening to our industries around us, as well as with COVID. As far as the declarations and things that we're being asked to do as citizens, we are waiting to see what the governor is going to do this week. I'm sure you've read all the media about the governor wanting to get back to work. You've seen some letters to the president about letting America get back to work. And all of us are ready for that. And we're ready for what those steps might be. I think it would be wise to give a cautionary tone about what it means to get back to work. I do not expect the governor to just untie this thing and we'll be back to work on Friday. I think it'll be a slow release, and it needs to be a slow release. So listen carefully as we prepare for what the next steps are going to be as a city in trying to get back to work. I also want to caution us when we do get back to work and when things begin to change and more people are allowed to do certain things, whether it's getting back to the office or getting back to restaurants or whatever it might be, we might want to pay attention to what might happen to our COVID numbers. To be realistic with you, I would fully expect when we get ready to get back to work, we'll see some COVID numbers go up. And then we're going to have to be calm. We're going to have to respond adequately and wisely and make sure that we're continuing to practice the things that we have been practicing. We said this a long time ago in relationship to the question that came up just a few minutes ago to the health department about tracking. You need to make the assumption that someone around you has COVID-19 and you're taking care of yourself, you're taking care of social distancing, you're taking care of the personal hygiene issues, you're not going to the store as a family, it's an individual going to a store. These are all the things that you know, but we need to continue to practice these disciplines, and even when we're out and about and we're with people practicing our social distancing. So be ready for that. The final thing I want to remind you of, as it was ramped up last week in our discussion, was the mental health initiative. And the website for that is Midland, and then the letter B, and the letter H, and the letter I.org. So midlandbhi.org to help us in this time with mental health struggles. There's not any shame in that. But we realize there's a lot of mental stress here with industry. Not only is it a virus that you can't see, but now people are being affected in their work life as well, and have been affected in their work life. And so there's a lot of stress coming at everybody in multiple directions. So I want to encourage you to use that resource, midlandbhi.org. We'll be in a city council meeting here in just a moment, and we'll continue to work on the issues of the city and what it looks like for the future for us. And then again, we'll be looking to see what the governor says later this week to determine what we can do and what we need to do as a city. With that, Aaron, I'll take any questions.
All right, the first one is, do you think you might reconsider the restrictions on capacity of businesses since we are in a slow burn?
We will reconsider capacity on business once we see where the governor wants to go here. I want to be in line with what we're trying to do as a state, but also as you've watched what we've been doing as a city, we have tried to do our thing and what's important for us. So we'll take a look at those numbers and again, wait and see where the governor lands on that, and then we'll make a decision as a city as to how we loosen the strings, so to speak, on businesses. And I even hate to use the phrase how we loosen the strings, because I really despise the fact that we have sort of taken over free enterprise in many regards. And so we need to let people get back to work, and that's why the warning from Dr. Wilson and myself is, regardless of what we do, it will not work, and we'll have to constrain things again if we have some type of sudden outbreak, if we don't continue to practice the personal hygiene issues and the social distancing issues that we're all practicing right now.
And then the next one is, how are we going to handle travel in and out of Midland?
Well, what we're going to hope for is as we get back to doing business, we will elevate the travel traffic, but we're really going to be at the whim, really not the whim, but at the direction of the FAA. We're going to have to listen to what they want us to do at the airport, what the airlines are going to do, and then we'll see how that translates into our new reality. That is not something we have a lot of control over. We'll be listening for that direction from the FAA and from the airlines as well.
And from the MRT, do you have any thoughts about the Railroad Commission meeting and what you hope for there?
I probably will just refrain from comment about what the Railroad Commission is going to do today, except for the fact that I hope that we allow the free market to do what the free market can do. And internationally, we continue to put the pressure on Saudi Arabia and Russia about what they've done. And it's going to take the free market to get us back to some form of normalcy in the months ahead.
We'll go in just a few more seconds to see if there's any others. All right, Mayor Payton, thank you.
Thank you, Aaron.
Everyone, that concludes our Unified Command Team press conference. Thank you for joining us. We'll be back here Thursday at 9 a.m.
Thank you, Aaron.